I became interested in healthcare primarily because I wanted to be involved in people's lives in a meaningful way, both in times of good times and in times of not so good times. And my first thought in life was that perhaps ministry was something that I would want to do, but as I got further into it, I realized that I wanted something of a more hands-on approach and something more practical to offer as well, and so I kind of diverged into the medical profession. I think what I envisioned going into medicine, primary care, was what I had envisioned a doctor to be. And when I got to medical school, obviously I experienced a lot of other ways to be in the medical profession and to do very good doctoring, but after being interested in a lot of those things on the way through, when all was said and done, I came back to what I really pictured what in my mind a doctor was, and that was a primary care physician that took care of families over a long period of time. The trust for the medical side of it has to kind of come over time, and doing things that are helpful to their medical need and things that are appropriate over time really helps to gain that trust. But that's really something that takes more time than just one visit. Well, there's an old adage in medicine that 90% of the diagnosis comes out of the history. So if you don't listen to the patient's history, it's likely that 90% of the information that you need to make the diagnosis you're never going to know. I think there's two aspects of the job that are particularly rewarding. One is helping people to make very positive lifestyle changes that not only impact their health but also their longevity and their overall happiness with life. I think seeing that occur over a period of time, helping people make those adjustments, is very fulfilling. And for me personally, and this is not something that a lot of doctors would probably experience, but I find a particular reward in helping through or helping patients through some of the most difficult parts of life, and particularly end-of-life care. And I feel like that's a very important aspect of our jobs, is that after we've done everything medically we can do, that in those last days when that last diagnosis comes, that we walk with the patient through that experience. I'm really a pretty basic guy. I'm married, I have 3 college-age sons, so I hang out with them, and I love college sports, football and basketball. I love Major League Baseball. I like working out in the yard. I like music theater. But really I have no exotic hobbies. I'm just kind of a basic guy that works a lot and does some of those things when I can.